Claire never liked reading about oncology medications. Every time she opened her notes, the names looked long, frightening, and confusing. She always told herself, "I'll read it later," but later never came. One day, during a clinical rotation, she saw a patient struggling through chemotherapy side effects. Claire felt helpless because she couldn't confidently explain what was happening. That moment changed everything. She decided she would finally understand oncological medications, one step at a time. The first thing Claire discovered was that cancer drugs are powerful because cancer itself is powerful. And every drug falls into a group based on how it fights cancer. As she learned each group, the big scary names began to make sense. She started with alkylating agents, like cyclophosphamide. She learned that this drug can irritate the bladder and cause bleeding, called hemorrhagic cystitis. The key: prevention, hydration, and Mesna, a protective medication that binds the toxic byproducts before they harm the bladder. Claire realized that watching for blood in urine, pain on urination, and keeping the patient well hydrated could prevent serious injury. Then she studied Cisplatin, another alkylating agent. It can damage the kidneys and cause hearing loss. Claire memorized the warning signs: decreased urine output, rising creatinine, and ringing in the ears. Nurses protect patients by giving plenty of 4 fluids and monitoring kidney function. Next came the antimetabolites. Claire met methotrexate, which blocks folic acid. That means it can cause mouth sores, liver problems, and dangerously low blood counts. But the antidote, leucovorin rescue, helps protect healthy cells. She also learned that patients should avoid NSAIDs and alcohol and report mouth ulcers early. Another antimetabolite, 5-fluorouracil, can cause severe diarrhea, mouth sores, and low white blood cells. Claire noted that early signs of toxicity include mucosal irritation and sudden fatigue. Nurses monitor stools, oral mucosa, and CBCs carefully. Then she reached the anti-tumor antibiotics like doxorubicin, the drug known for its red color and for stressing the heart. Claire learned to look for shortness of breath, swelling, and new fatigue. Before giving this drug, nurses check the patient's heart function. Another member of this group, Bleomycin, can affect the lungs. That means any new cough, shortness of breath, or crackles in the lungs is a warning sign. Claire learned it is important to monitor oxygen levels and report breathing changes quickly. Next came the Vinca alkaloids, especially Vincristine, which can damage nerves. Claire learned to watch for tingling, numbness, foot drop, and constipation due to nerve impairment. Because it is so toxic to nerves, it is never given into the spine. Finally, Claire studied the hormonal therapy medications like tamoxifen. It blocks estrogen, helping to fight breast cancer. But it increases the risk of blood clots and endometrial cancer. Claire learned to watch for leg swelling, chest pain, shortness of breath, and abnormal vaginal bleeding. As Claire finally understood the medications, something beautiful happened. Her fear turned into confidence. She realized these drugs were not meant to intimidate her, they were meant to save lives. She decided to help others who were just like she once was. She gathered students who were struggling and began explaining oncology medications in simple, clear language. She told them what each drug does, the side effects to watch for, and how nurses protect patients. Her classmates felt relieved. They no longer feared the medications because Claire had broken them down into stories they could understand. The same way she had once been lost, they had also felt overwhelmed. And the same way she had found understanding, they found clarity through her. Today, Claire teaches one message: oncology medications are powerful, but understanding them gives you power too. Don't run from the names, learn their stories. When you understand the drugs, you protect lives. And that was how Claire, once reluctant and confused, became the one everyone turned to for help, proving that learning, courage, and compassion can transform anyone into a confident caregiver.